Occupational therapy helps people across the lifespan do the things that they need, want, and are expected to do.
Occupational therapists can work in schools, hospitals, outpatient clinics, and many other settings.
How is OT any different than PT? That's a great question. OT does functional activity, like you need to get in the shower. PT might help you get in the shower and out of the shower. Even if you drop your soap in the shower, that's where OT comes in.
Hi, so why Pitt OT? Well, Pitt OT faculty has expertise across the lifespan, across ability and disability experience, and across practice settings. So students who come to Pitt Occupational Therapy have an opportunity to develop into any type of professional they want to be with the expert right beside them.
Hi, I'm Dr. Joanne Baird. I'm an assistant professor here at the University of Pittsburgh in the Department of Occupational Therapy, and I'm the admissions coordinator for the OT program. I wanted to tell you that if you want any information about admissions to our program, go right to our website. All the information is on there. Here are some things that we look for when we look at applications. We are looking for applicants who have a strong academic background, who have leadership potential or experience, and professional exposure. Now, we know you're not an OT yet, but we're looking for individuals who have exposure to populations that an OT might work with or have demonstrated an interest in something that an occupational therapist might do. Hail to Pitt.
I'm Julene Radikowski. I'm an assistant professor in the Department of Occupational Therapy, and I do research on aging older adults in ways occupational therapy can help people be independent in their daily activities and maintain living in the community. I really want to see when and how OT can help older adults be proactive in their aging so that we can help them stay in the home. And I'm also interested in their family members or caregivers who help them in best ways that occupational therapy services can intervene to understand the needs of their loved ones. So that's what I do.
Pitt Occupational Therapy offers a dynamic opportunity for you to learn from professionals, to engage in research, to engage in practice in the community, and we're a lot of fun.
Say up, you say soda. Up,
Soda!
up.
Soda! Through participation in UpSoda, students in our programs can participate in fundraising efforts, community outreach, and educational activities.
I am Jennifer White. I'm one of the instructors here at the University of Pittsburgh in the Occupational Therapy Department, and I primarily teach biomechanical theory and practice, and I'm also involved with helping with field work. And one of the things that we do with field work is try to give an amazing exposure to different settings, one of which is the Birmingham Free Clinic, which I am a volunteer. I'm an occupational therapy volunteer at the Free Clinic, and I also take fieldwork students there, so you should come to Pitt.
Hi, my name is Kylie, and I chose Pitt OT because I've always wanted to help people to be able to be independent, and I love being able to help individuals do their daily activities that they enjoy.
Because I wanted to be amongst the best and the brightest of our future. This is the powerhouse of occupational therapy research, and there is absolutely nothing better than being a part of that.
Pitt for our national and international reputation, academics, research, and outside the classroom experiences.
Okay, so many of you have asked why Pitt OT? Now that you've heard from a couple of the professors, faculty, and students in the program, I wanted to give you my opinion. I chose Pitt OT for our incredible national reputation. We're number 4 in the nation. Another reason that I chose Pitt OT over other OT programs is for the incredible research that comes out of our department and our university as a whole. Although I may not personally be interested in conducting research, I do believe in the importance of learning about evidence-based practice, learning about how research is conducted, learning how to analyze research articles, and to use the most current and up-to-date evidence to support your practice with patients to make sure that you are providing the best care possible.
You're a good soldier, choosing your battle. Pick yourself up and dust yourself off and back in the saddle.
Everyone, thank you so much for following along with me and Pitt OT today. It was awesome to be able to show you a day in the life of a Pitt OT student and show you some of the amazing reasons why Pitt OT is the absolute best. If you have any additional questions, please feel free to reach out to otpitt@pitt.edu.
Snapchat friends, thanks for following.